Hi, my name is Michaela. I'm a YC nurse practitioner student, and today we're going to do a neurological and musculoskeletal assessment. Is that okay?
Yep.
Okay, so first we're going to start off by inspecting the patient's cranial nerves. That consists of the facial construction, nose, eyes, jaw, mouth. So the first cranial nerve that we're going to assess is the olfactory nerve. So we're going to have the patient occlude one nostril, close his eyes. And what do you smell?
Vanilla.
Good job. And close the opposite nostril. And what do you smell?
Lime.
Okay. Cranial nerve 2 is the optic nerve. In this test, we're going to do a confrontation test. So I'm going to have the patient occlude one eye, and I will occlude the opposite eye. And then we test the visual fields. So can you tell me how many fingers I'm holding?
1, 2, 3, 2, 3, 1.
Okay, the opposite. And then I'll include the opposite eye.
You include your 1, 2, 3, 1, 3, 1.
Okay. So the next cranial nerve is Perla. It's cranial nerve 3, 4, and 6. So that tests accommodation. So with accommodation, I want you to look at the pen light, and then we'll center into your nose. The pupils should constrict and move inward, which they do. Next, we're going to have the patient follow the pen light with his eyes in all 6 fields. Okay, next we're going to dim the lights. I'm going to have the lights dim, and then I'm going to shine the pen light to the side of the eye, noting the reaction of the pupil and the pupil size. Okay, positive reaction and constriction with light, about 2 millimeters for his pupil size. All right, so that's Perla. That's how we test Perla. And then the 5th cranial nerve that we missed was the trigeminal nerve. So that is the facial nerves. We're going to have the patient bite down and clench, and we're going to test the masseter muscle and the temporal muscle, palpate. Can you open your jaw against resistance? Okay, perfect. Next, we're going to test sensory. And sensory, for the trigeminal nerve, it's the ophthalmic, the maxillary, and the mandibular regions of their face. We're going to use a cotton tipped applicator, soft and sharp, and he's going to let me know if he feels sharp or dull sensation in either location, okay?
Dull. 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 Sharp. 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 Dull. 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 Sharp. Sharp. Sharp.
Okay, perfect. And the last sensory test we would do for cranial nerve 5 would be using a cotton tip applicator. You could roll a cotton ball up and kind of wisp it on his eye. I'm not going to do that for the exam, but his eye should blink, and that shows good reflex, corneal reflex. So the next cranial nerve we're going to assess is 7, and that is the facial cranial nerve. So I'm going to have the patient close their eyes really tight and frown for me. Smile and puff out your cheeks. Okay, perfect. Cranial nerve 8 is acoustic cranial nerve, and that includes the Ryan-Weber test, which we already completed in previous assessments, so we're not going to do that again, but we are going to do the whisper test. So I'm going to have him occlude the opposite ear. I'm going to walk a few feet away, whisper. Okay, and then I'm going to do the same on this side, but I do not have much room, but he would occlude this opposite ear, and I'd whisper. Okay. All right. The next test is cranial nerve 9, and that is the glossopharyngeal cranial nerve. I'm going to have him open his mouth and say, ah, and stick out your tongue. Okay, the uvula should move up. And then can you move your tongue side to side? Okay, perfect. In this assessment too, you can do the gag reflex. I just wanted to note that you could assess the gag reflex. Cranial nerve 10 is the vagus nerve, and we want to make sure that the patient is swallowing okay. Can you take a big gulp for me? And then say, hi, my name is Ryan.
Hi, my name is Ryan.
Okay, so I don't know any hoarseness in his voice or his tone. The next cranial nerve is the spinal cranial nerve, which is the 11th. So I'm going to have the patient rotate his head from side to side. Good job. And then I'm going to push against, can you push that way against resistance? In this side? Okay. And then shrug your shoulders against resistance. All right. The last cranial nerve is the 12th cranial nerve, which is the hypoglossal. I'm going to have you stick out your tongue for me and move it from side to side again, up and down. And then close your mouth and put your cheek on each or your tongue on each cheek. Good job. All right. So the cranial nerve assessment is completed. Next, we're going to evaluate coordination and motor skills. So the next assessment includes, can you touch your nose to my finger with both? Okay, and do the other hand and do the same thing. Okay, and then can you go on your thighs in a rapid motion back and forth, back and forth? All right. Can you walk a few steps this way and back? And then again, but heel toe, heel toe. Okay, while you're standing up, can you open up your legs just a little more wider and kind of cross your arms? We're going to note if he has any swaying or any balance, just, not coordinated with balance, any swaying, and then can you close your eyes and do that for another 30 seconds? We're just noting balance, and he does have steady balance. So I'm going to have you sit back down for me, please, and lay flat for me. And then can you move your heel from shin to foot on both sides? Okay, beautiful. And then can you sit back at the edge of the bed? Thank you, Ryan.
Mm-hmm.
All right, so again, we're going to assess feel and touch sensation. So I'm going to use a sharp and dull edge of the cotton tip applicator, and can you let me know where you're being touched and if it's dull or sharp?
Mm-hmm.
Okay, close your eyes.
Forehead dull. Left arm sharp. Right cheek soft. Nose sharp. Right forehead dull. Right arm dull. Right bicep sharp. Right hand dull.
Okay, the next test is, you can keep your eyes closed. We're going to do the 2-point discrimination test. So we'll either use one cotton tip applicator or two, and he's going to let me know if he's feeling 2 points of touch or one. So close your eyes.
2 1 1 1 2 2.
Okay, perfect. All right, the next is, can you hold open both palms? I'm going to draw either a letter or number, and can you let me know what you feel?
8. A.
Beautiful. All right.
Okay, there you go.
All right. Next, we're going to assess your position of your hands and your feet. So can you close your eyes? Okay, and just let me know if your position of your fingers are moving up or down. We're going to do the same with his toes.
Down. Up. Down. Up.
And same with his feet.
Up. Down. Down.
Okay, next we're going to test the plantar reflex. We're going to use the bottom of our reflex hammer to see if he has any positive Babinski signs. That is not normal in adults. You'll see that typically in newborn where they fan their toes. And that is a negative reflex, so that's good. All right, so next we're going to assess the deep and superficial tendon reflexes. We already assessed the abdominal reflexes in a previous assessment, so we're going to skip that. But we are going to look at some of the tendons using our reflex hammer. So the first one we're going to start at is the bicep tendon. We're going to make sure that we feel the tendon here and make sure that his arm is really flaccid and relaxed. Okay, so positive contraction, the bicep tendon innervates C5 and C6. Next, we're going to do the tricep tendon, and the best way to do it is hold up his arm, make sure it's flaccid, it's not contracted, and locate the tricep tendon. And the tricep tendon innervates C6, 7, and 8, and we will hit it. Okay. All right. Next, we're going to do the patellar. So we would locate the knee and right underneath it. Make sure that his feet are slightly elevated from the ground. And we'll do the opposite. All right. So the next cranial nerve we'll do is, the next deep tendon reflex we'll do is the Achilles. So the Achilles is behind the heel here, and we want to dorsiflex the foot up to get a good reflex. Make sure you locate the tendon. Okay, and this side. All right. Lastly, we're going to do the brachioradialis, and that is right here. Locate the tendon. Okay, perfect. All right. And then the ankle, we're going to assess for clonus of the ankle. So we're going to dorsiflex and plantar flex the feet a few times. And then keep the foot in a dorsiflex position. And you shouldn't see any rapid movement. That would be positive for clonus. Okay, now we're going to do the musculoskeletal assessment. We're going to inspect the patient's joints, all of the musculoskeletal system from head to toe, the joints for similarity. We want to note for any deformities, any nodules, growths around the surrounding tissues. And then once we get down to the, throughout the whole musculoskeletal system, we would also palpate, we would note for swelling, crepitus, pain, tenderness in any of the locations throughout his body. So as we inspect the muscles and compare from side to side, and we palpate all of the bones once we get to each category and subcutaneous, all the tissues for warmth, tenderness, and pain, we're going to test all the major joints for extension and flexion and abduction and adduction. So we're going to start off with the wrists. I'm going to have you hold out your hands and adduct and abduct away, and then flex up and then extend down. All right, and then I'm going to have you put your hands in a prayer position. This tests for carpal tunnel, and push your wrists inward like this. If you have any pain or numbness at the fingers, that can indicate carpal tunnel. And do you have any pain with doing that? Okay. And then you can also test carpal tunnel by going opposite prayer and push those wrists together. And do you have any pain or numbness? All right. Next, we're going to test the elbows. So we're going to inspect the elbow for any swelling, pain, any deformities on either elbow, which I do not see, or any effusions at the joint. Any pain with touch? All right, so we'll locate the tip of the elbow, and we'll relax. We'll palpate the medial elbow and lateral aspect of the elbow for any tennis elbow. And then we're going to have them do pronation and supination. And that tests flexion of the elbow, and then can you flex your elbow and extend. All right. Beautiful. Thanks for doing both sides. And then we're going to inspect the shoulders. So we want to note for symmetry, any deformities, any pain with palpation. All right. There doesn't look to have any nodules, deformities, and no pain. So what we're going to have the patient do is flex their shoulder up. So I'm going to have you raise your shoulder up. All right. And then extend your shoulder back. All right. Perfect. And then adduct is a hug. And then abduct is arm to your side. All right. Thank you. And abduct. And then the temporal mandibular joint is just your right here where your jaw is. Can you punch and move? Good. All right. Next is your cervical spine. So, do you mind standing up for me? And turn around. All right. So we'll note his cervical spine. We'll inspect the location of the curvature. We want to make sure that there's no scoliosis. We would note this surrounding tissues for any crepitus, any swelling, any pain with palpation.
No.
Okay, so we would note the C7 bony prominence down the spine and work our way down the vertebrae for any deformities. So for flexion of the spine, I'm going to have him bend down and touch his toes. And again, we're noting for any curvature, abnormal curvature of the spine, you can stand up and then extend your back. That's extension. Okay, any pain with that movement?
Nope.
Okay, beautiful. And then can you twist from side to side? All right, so normal curvature of the cervical would be concave, thoracic slightly convex, and lumbar, again, slightly concave. Next, we're gonna, can you scooch up a little bit? Next, we're gonna assess the thoracic spine and note for any abnormalities as well. Going back to cervical, we're gonna have him put his chin to his chest and then extend back. All right, beautiful. And then can you look side to side for me? Okay, while you are flexed down to your toes, we're going to assess the symmetry of his hips. We're going to palpate the hips, making sure that they're even, that there's no crepitus. Any pain with palpation?
No.
No? Okay. So now that you can touch your toes, can you lie on your back here for me? And flex your leg up for your hip. You want to feel the joint, and then can you do that again with the other? Okay, perfect. And then can you lie on your belly? And then lift your leg up. And the opposite leg. All right, beautiful. Okay, can you sit at the edge of the bed for me? We're going to do a few more assessments at your lower extremities. All right, so now we're going to assess the legs and the knees, looking for the joints, making sure that they're symmetrical throughout. We're going to inspect. We're going to palpate for any crepitus, any effusion at the knee joint, and I do not feel any swelling, any nodules, or protrusions or abnormal growth defects. So we're going to palpate the medial knee patella and the lateral patella. Okay. And then the posterior knee, the fossa behind the knee for any infusions. Okay, perfect. And then I'm going to move his knee adduction and abduction. Abduction and adduction. Any pain with that movement?
Nope.
Okay, now we're going to go down to his feet and ankles. We're going to inspect for any trauma, any infection, any pain with palpation.
Nope.
We're going to palpate the heel. Look at the arches of his foot. Make sure he has arches. All right. And then we're going to flex up and then extend, flex up and extend. All right, and then we can just give his ankles a twist for inversion and eversion of the ankles. Any pain with that movement?
No.
All right. And that concludes our assessment. Thank you so much. Okay, an additional assessment, a neurological assessment, is to be able to identify objects. Can you close your eyes? Okay, can you hold out your hand and tell me what you're holding?
Pen.
Okay, in the opposite hand, can you tell me what you're holding?
A remote.
Okay, thank you so much.